Thanks to tremendous technological advancements and new innovative surgical procedures developed in the last 4 decades, the dream of clear vision without corrective lenses can now become a reality for almost everyone who wants to live a lens-free lifestyle. Every year in the United States, over 2 million patients are diagnosed with cataracts. A cataract is a clouding of the eye's natural lens inside the eye, which interferes with light reaching the retina. Left untreated, it can eventually cause blindness. The good news is, cataract surgery is the most common and one of the most successful surgical procedures performed today. Vision for most people remains relatively stable until they get into their 40s, whether they're nearsighted or farsighted or normal-sighted. Around that time, the eye's natural lens begins to gradually thicken and harden, making it difficult for the muscles inside the eye to focus the lens. This is known as loss of accommodation, or presbyopia, and its earliest symptom is difficulty seeing things up close without the use of reading glasses or cheaters, as some people call them. Many people who are farsighted before the onset of presbyopia can see well at all distances. But when the natural lens loses its flexibility, it often becomes necessary for them to wear bifocals or even trifocals to see well at all distances. If you happen to be in this 40 and over age range and you're experiencing problems such as these, you may be eligible for a procedure that can restore your vision and eliminate your dependence on glasses for most activities. Cataract surgery is the procedure name we use if you have a visually significant cataract and you're experiencing blurry or cloudy vision. If you do not have a cataract, or if your cataracts are in the early stages of formation, the procedure is called refractive lens exchange. To restore vision after the natural lens is removed, Dr. Green will implant an intraocular lens, or IOL, into the place that held your natural lens. The traditional method of removing a cataract along with implantation of an intraocular lens is one of the safest and most successful procedures performed in medicine today. Now, a technological breakthrough with bladeless laser cataract surgery is available that has significantly improved the precision of several of the most critical steps in cataract surgery. With laser cataract surgery, Dr. Green will customize your procedure to your unique visual needs, resulting in better visual outcomes and potentially making cataract surgery even safer. With traditional cataract surgery, incisions are created with a blade, while with laser cataract surgery, they are performed with the precision of a femtosecond laser. If the patient has astigmatism, traditional cataract surgery requires a blade to create arc-line incisions in the outer margins of the cornea to correct the astigmatism. While with bladeless laser cataract surgery, these incisions are performed with the laser. To remove the cataract, an opening must be made in the thin capsular membrane that surrounds the lens. This step is called the capsulorhexis. Studies have shown that less than 10% of manual capsulorhexi, which are made with a bent or shaped needle, have been able to achieve the same accuracy that is produced when they are made with the laser. The consistently precise laser-controlled capsulorhexis contributes to better lens positioning and therefore more predictable visual results, which is especially important with premium IOLs. Once the outer capsular tissue is opened, the lens must be split into manageable size pieces for removal. Traditional phacoemulsification uses ultrasonic energy to divide the natural lens into quadrants. This step is now performed in an instant and with much less energy with the femtosecond laser. With both traditional and laser cataract surgery, the fragmented pieces of the cataract are vacuumed from the eye with phacoemulsification. However, with laser cataract surgery, the femtosecond laser actually softens the lens, so less ultrasonic energy is required to remove the cataract. This means there is less stress to the delicate fibers and membrane that hold the intraocular lens in place. Once the cataract is removed, the intraocular lens of your choice is inserted through the self-sealing incision and locked into position. Typically, no sutures are required.
I've got an iPhone, I've got an iPad. We can only learn and embrace technology, not fight it. So I said, great. I've seen the effects of laser in so many other things. Why not do it quicker, faster, and with more accuracy?
The procedure is performed as outpatient surgery, one eye at a time. Today, people who have their natural lens removed can elect to have the standard IOL that typically provides excellent distant vision, or one of the more technologically advanced IOLs that can provide a full range of vision, meaning you can read, see clearly in the distance, and everything in between, with little or no dependence on bifocals, trifocals, or contact lenses for most of your activities. Dr. Green will want to visit with you to determine which presbyopic IOL might be best for you.
We have a lifestyle form that I have each patient fill out, and based on the answers that they give me on that form, plus the measurements that we do, putting these two things together, I can decide which of all the lenses available are going to be best for that particular patient.
It's very seldom that you can get it exactly perfect in terms of the balance of seeing long distance and being able to read up close. But what Mary did, I wouldn't call it a miracle because I just think she's very good at what she does. And what she did is listen to me, listen to my needs, listen to my concerns. I didn't want to have reading glasses if I could help it, but I also wanted to be able to see to drive again, so you have to see far away. So we spent a lot of time talking about some solutions, and one of the solutions was to put a monotype lens in one eye and the other kind of lens, a crystal lens, in the other eye, and it's given me perfect vision.
You don't see me wearing glasses, and they were a part of my body, well, let's do the math, for 45 years. The only time that you'll see me with glasses are with my anniversary present, so I can block out the sun when I'm driving or I'm, playing sports outdoors.
She explained to me the whole process, and Dr. Green was very patient and telling me all the advantage, and of course a little bit of a side effects, because nothing is perfect. And gave me all the options about it, and give me time to think about it. And so I make the decision that I think it was the best for me, and I'm very happy about the surgery. Dr. Green has a very steady hand when she does the surgery.
Vision affects almost every aspect of your daily life, and what could be more rewarding than helping people improve their vision? That's why I love doing ophthalmology.
It's freed me from having to have a pair of glasses every time I turn around in every room. And because I am in real estate, I have to read contracts, and not always in the best of lighting. And so having the crystalline in has just helped tremendously. I mean, Dr. Green has made a huge difference in my life and freeing me up to do things without worrying about glasses all the time.
I could be president, chairman of the board of Dr. Green's fan club. I mean, I've referred patients, and when people have asked me, the who, what, why, when, and where, I just simply tell them, Mary Green, eye excellence, you won't regret it.